welcome back to another week of Bulletproof Hygiene. I'm so excited to have you joining us this week because I'm really excited about this topic and our guest. Hold on to your seats. We're going to learn a lot. We're going to hear hopefully some new things. And as always, my hope is as we learn and grow, we're going to stretch ourselves and be able to take better care of our patients. So without further ado, I want to say that I think we've all probably heard sayings about the power of the tongue when it comes to how we communicate. But today we are talking about the role and power of the tongue toward physical health. And you may be surprised to learn that it really is the body's rudder to health and quality of life. And today I want to introduce you to Dr. Samira Jafari. We are so thankful for you taking time to be with us today and to share your wealth of knowledge. So as I introduce you, would you mind to share a little bit about yourself and your experience and history thus far?
Absolutely. Well, thank you so much for having me, Charissa. I'm excited to be here, and I hope that I can talk about a topic that's not usually spoken of. So hopefully I'll be able to have some of your listeners be more interested in tongue ties and airways, because we always need more hygienists on board. And like hygienists as a whole, I'll go ahead and put that out there. I feel like hygienists as a whole are a lot more aware of the whole body and how our mouth relates to our overall health than most us dentists are. So I feel like you guys are driving forces for patient health and patient care. So I'm really excited to be here. I graduated, a little bit about my background. I graduated in 2013 from Medical College of Georgia, which is now Augusta University. I'm a general dentist. I've been practicing dentistry since then. But I was lucky enough that very early on in my practice, so it was either like late 2013 or early 2014, that I had the opportunity to attend a lecture by Dr. Ben Moralia. And I don't know if you've heard Dr. Ben Moralia speak, but he's a very charismatic speaker. He was speaking on early childhood development, growth and development of the upper jaws. And it really, I mean, he is a great speaker, but the topic itself just really spoke to me, and it was very intriguing for me, and it really piqued my passion for something that I had no idea about and I hadn't even heard about in dental school. So it was and I didn't like have kids at the time, so it wasn't something that like I connected with, but I felt like there was such a need, because after I took his course, and his course was in Orlando. And I remember being in the airport, and all the kids that come to Disney, was it Disney World, Disneyland?
Yes.
I don't know which one is where, but there's so many kids, and everywhere I looked, I could see signs without even looking in the mouth of these kids. I could see there was so much need for this type of treatment. So I became really passionate, and ever since then, so like the past 9 years, I've tried to like take as many courses as I can. And I'm sure some of your listeners are already in the airway community, and I know you are. There is a pretty big rabbit hole. And I've definitely dug deep. So I'm just trying to learn as much as I can. There's so much to it. And even after 9 years, I feel like I'm still kind of like,
scratching the surface.
Yeah. getting deeper and deeper, learning more and more, and there's so much more to learn.
So when this kind of set you on fire and you saw something you'd never seen before and you said, oh my gosh, this makes sense to me, I got to do something about this. Did you immediately start incorporating that into your practice, or did you take a little while and feel like you got really educated? And what did that look like in the progression of the practice?
So I definitely started immediately educating parents and talking about the importance of early development and the signs to look for, and how so many kids are labeled like ADD, ADHD, or some other issues where it could just be related to the way they're sleeping. So I definitely started incorporating it right after coming out of that course.
Okay.
And I started using appliances. I started using MyoBrace. I don't know if you're familiar with that. It's basically just like a growth appliance that helps correct some minor things, but helps with also establishing nasal breathing, and helps with, alongside with my functional therapy, to help like a better rest position for the mouth.
Mm-hmm.
Then as I got, more and more, I saw there were definitely limitations to MyoBrace. So I've added, as I've gone to my my knowledge base, tongue ties themselves came in a little bit later. So in 2019, so before that, I would see tongue ties and, to an extent talk about tongue ties, but not, hadn't really like delved in or looked at it until 2019. And it was actually a hygienist who's a myofunctional therapist, Beth Sohail, who we were kind of like working, I was referring to her for myofunctional therapy, and she encouraged me to take a course from the Breathe Institute of Dr. Charissa, who is an ENT out in California, who's pretty much dedicated his practice to advancing the field in airway treatment, and also recognizing and research on tongue ties for kids and adults, because most of our research and literature is more surrounded towards infants, and we don't, and it's like, okay, if you pass infancy, then you're fine. And we're finding out that that's not true. So that course really opened my eyes, and that's when I really started treating, recognizing more tongue ties, was able to diagnose tongue ties better. Because before that, in school, we didn't really learn much about tongue ties.
Right.
Treatment, right? I remember maybe I don't remember learning anything about airway at all. And the management of or how to identify airway issues. I do remember maybe like one phrenectomy lecture in an oral surgery class, but the main thing I learned about the tongue in school was how to safely keep it out of the way. I had to do the procedure, so there wasn't really much education there. So it was in 2019 where I learned more about that, and that just like opened up another huge can of worms with how you can help, how I could help patients. And then my daughter was born with a tongue tie.
Wow.
Then I was like, okay, well, I'm already doing it for kids and adults, so now I have to treat infants too. So I haven't had the training for that. So it's definitely been a snowball effect of different courses and different amazing leaders in the field.
Yeah, that's awesome. So tell me what a day in your practice looks like as far as procedures and treatments that you offer.
Yeah, so great question. So we are a full service dental practice. I started integrated family dentistry just to be able to have a different approach to dentistry that I was taught in school. I didn't want to just look at teeth, and I didn't want to just drill and fill. I wanted to look at the whole body and how the mouth is connected to the whole body. That a big part of that is obviously the airway and making sure that patients are have what they need up here to have better health down here. We have hygiene. I have an amazing hygienist, which I know you know, Lacey Cooper, who is we're so in sync with, you know, whole mouth, looking at the whole mouth and paying attention to the microbiome and respecting the oral microbiome and all of the treatments that come with that, but also asking those different questions like, do you snore, or you know, how are you sleeping, or you know, are you mouth breathing? Some of the things that patients haven't heard before. So even though we still do general dentistry, we are asking questions. We see a lot of we get a lot of referrals from other providers, hygienists, the other therapeutics, speech therapists, lactation consultants, occupational therapists, physical therapists. It's amazing how the whole body is connected, and you know, we get patients coming in looking for structural evaluations to see if the child is growing and developing normally, or if there's tongue ties. We do a lot of interceptive orthodontics for kids to help with growth and development of the jaws. We do palatal expansion in adults to create more room for the tongue and help improve the airway. We do tongue tie releases in infants, kids, adults, everybody that's interested. We also try to gather information and see if we can somehow contribute to advancement of the field.
Yeah, that's awesome. And honestly, I'm excited to have you join us today because much like you, when you were in middle school, you didn't learn much about this. When I was in hygiene school, you know, it was kind of the same story. You know, we knew how to identify, you know, a pretty severe tongue tie. We knew what that was like. But there was not a lot of talk about airway and expansion and tongue thrusts and improper swallows. You know, we didn't fully understand the long-term implications of these conditions or what could be done to address it honestly, and why it even really mattered. And I feel like as hygienists, we are looking at all the components of the patient's mouth, head, and neck at each appointment. And the goal being to help every patient achieve health and overall wellness. These are really important conditions that we need to be screening for and discussing. So, you know, we're here to learn and glean from you all that you have to share, and excited to hopefully expand our horizons. So I do want to start with specifically tongue ties. Like I said, I think we can all really easily recognize an advanced tongue tie where, you know, the patient can't even really lift their tongue and you see that, you know, the tip is really tied down to the bottom. You know, the lingual frame is just so short and attached. The patient has really limited movement, and obviously that can impact their speech and function. But I know that research is showing that even mild to moderate tongue ties can have serious implications. So tell me what we should know and be looking for when it comes to tongue ties. You know, what will we observe visually, both intraorally and outside the mouth? And how can we take measurements or assessments to really identify these issues?
So you're absolutely right. A more severe tongue tie is a lot more easily diagnosed. But I will tell you, I still see patients my patients that I saw that have been patients of mine forever, and they come in for that they would come in after I had my course with Dr. Zaghi, and I'm like, has this tongue tie always been like, how have I not seen this? Like, because like when you're taking the course, you're like, no, I can't think of anyone. Like, I don't think I would have missed it. But then it's things that you're missing all day because you're not looking. It's not
Right.
in our radar, right? But you're absolutely right. If you are looking, if a patient is has a very severe tongue tie where it's like connected to the tip of the tongue, and they can elevate, those are a lot easier seen. But I also see a lot of patients in their 30s, 40s, 50s with these severe tongue ties, and they can swear they've never, had any issues with their tongue, and that no one has ever mentioned that they have a tongue tie, and they're like literally connected to the tongue. So it always blows my mind, but I totally know why, because I was the same.
Right.
So I think the first thing is just looking, because a lot of times if you're looking, you'll be able to see a lot more than you think. But some tongue ties look like they're not. It looks like the tongue is moving. It looks like the tongue has more range of motion, but it may not be true range of motion. There may be a lot of compensations. Obviously, the function of the tongue is super important in our body, and it's important in breathing and swallowing and like eating with speech. There's so many things that a tongue does on a daily basis, and the function is so important that when there's restriction, the body being super smart and trying to figure things out, we start compensating in different ways to be able to function better. But over the years, those compensations are what kind of build up and start causing other issues. So we can always look for a forward neck posture. So if a patient is using a lot of these muscles to function over the years, you can have a more forward neck posture to be able, or it's also a compensation for opening the airway. So if the airway is small and you bring your neck forward, you can breathe better. So obviously oxygen being super important, the most important nutrient, where we can only live 3 seconds without 3 minutes without oxygen. Our body is very in tune to that carbon dioxide oxygen exchange. And so we will do anything to compensate to be able to breathe. Forward neck posture is one of those, which also a lot of neck, working these muscles a lot. So if you're using the floor of your mouth to help elevate your tongue, you will get tension in the area. You get tension in the TMJ muscles, and over time, those can become chronically fatigued. The muscles of the face. So a lot of headaches. I see a lot of improvements with headaches in adults, a lot of chronic neck and shoulder tension in the back from that forward neck posture. So that would be what you would look at on the outside. There's also with the sunken in cheeks. So like if you see a patient that has really pursed lips with a lot of lines around, that's because they're swallowing like that. They're tightening that orbicularis oris muscle that goes around the lip, and they usually also have a lot of crowding because they're putting pressure on those teeth. But that's because the tongue is not doing its job on the inside. So they're using their cheek on the outside to be able to swallow. So those are some of the things from the outside that we can look at. On the inside of the mouth, we can, the crowding, small upper jaw that's deep and V-shaped or narrow, tori, so big tori on the inside, exostosis on the outside. That could be related to the way if they're the way the teeth are positioned, or if they're clenching because they're trying to open their airway, or if they're putting horizontal forces on the teeth because they've swallowed like this and the teeth have tilted in. So now in their excursive movements, they are putting more forces on, horizontal forces on those teeth. You'll see those things inside the mouth. Also, just patients that have, mouth breathing wreaks havoc on oral, oral health as a whole. It creates a much better environment for the bacteria to thrive, or bad bacteria to thrive. So anything with cavities, gum disease, all of those, inflammation in the gums, can be signs of an airway issue. And part of that is obviously a tongue tie.
Yeah. I would add in scalloped borders of tongue.
Oh, yes.
See that sometimes the tonsils like really,
Oh, yes.
from that mouth breathing aspect. So
absolutely.
Lots of things that we can look at and, ask patients about. So I want to shift a little bit to, especially for adults, what questions can we ask our patients to help them kind of gain an awareness of how the tongue tie can be impacting them? Because like you said, most of these patients, they are, in their brains, they're thriving. This is how they've always lived. There's not, a big major speech impediment, as far as they know, they're eating, they're swallowing fine. They feel like they're breathing fine. So, they don't understand, like I said, the implications of the condition or how they could benefit from a release. What are some questions we could ask to kind of help them start, thinking through that themselves?
Yeah, so that's a great question, because some patients, as you know, as with anything new that we bring up, because dentistry has been done the same way for so long. So when we bring something new, sometimes it's a difficult conversation. And frankly, some patients aren't ready to hear that. So we usually start with asking about sleep, which I think is one of the biggest things that we're trying to help patients with, because it is so important and it can have such an inflammatory response to the body if we are not sleeping properly. So, so we always start with asking about sleep. We ask if they're snoring. So we ask about sleep. So we ask if they're snoring, if they're breathing, mouth breathing, if they are sleeping through the night, or if they're waking multiple times to use the bathroom. We are asking if they can go to bed easily and wake up refreshed, or do they sleep 7 hours, 8 hours and wake up super groggy and not ready for the day? And some patients open up and they're like, oh yeah, I do that. Or yeah, tell me more about that. But some patients are like, no, I sleep just fine. I don't snore. I don't mouth breathe. And they have like all these issues, but they're not ready to hear it. So it's our job to just open the conversation, and maybe down the line, if they see that those things are impacting them, they will ask those questions when they feel more comfortable about it. But to answer your question, we start with asking about sleep, but also we hint to it if we do see the other signs that I mentioned, with like inflamed gums and if they have tori, or if we see an obvious tongue tie, we inform them, hey, did you know you have a tongue tie? And 9 out of 10, they're like, no, no one's ever told me that. And depending on their level of interest, then we go deeper into the conversation. We always recommend a full functional evaluation, so that just because they've been like that their whole life, they don't really know how they're being affected. So we work with we work with different therapists, mind functional therapists. Lacey Cooper is obviously a mind functional therapist, but there are other amazing mind functional therapists in this state and out of this state that we refer to, and we recommend a full functional evaluation so that the patient, it increases the patient's awareness also to what kind of, how a tongue tie could be affecting them.
Yeah.
And sometimes they're really interested, sometimes they're not. So we kind of, you know, we start the conversation. If they're interested, we just feed them whatever they want. But if not, we tread lightly.
Yeah, for sure. You know, and I think sometimes we as clinicians and professionals can get a little overwhelmed when we learn something new and we think, oh my gosh, how do I talk to somebody about this? You know, and especially as hygienists, we get stuck in the rut of like, I have an hour with this patient. I don't have time, you know, to have all these conversations. But I have found, because this year is markedly a big year for me to learn more and more about airway. And so I'm one of those people, like when I learn something, I can't be quiet about it. So I have started talking more to my patients about it. And oh my gosh, my mind is blown. How many patients, when you ask, hey, do you have any difficulty breathing through your nose? Like so many patients are saying, oh yeah, I can't do that. I'm like, what? And it's something I've been seeing them for years and we haven't discussed. I actually just had a patient last week. I actually gave her your information because we started looking, and I've been treating her for perio for years, very successfully. She comes to me diligently because we've gotten her in a good, stable place. But this time I looked at her mouth, and we update our kind of comprehensive exam every 3 years. And we just taken a Panorex. And so I was looking at all of the different things, and I had her open, raise her tongue up. And I was like, oh, she can't go very high. Like she's got a tongue tie. And then I really started looking at the formation of her mouth, and she has a very narrow, long upper jaw. And so we started talking about, you know, I was like, wow, I've never really noticed this for you. I'm learning more and more. And then we started talking. She said, you know, my son, I have 3 boys. One of my sons has a tongue tie, and we've been struggling with speech. Like we've been to a couple of speech therapists, and I'm like, oh my gosh, you have to go to Dr. Jafari because this is, you know, you could really set him on a course to really help better his improvement and development as he's growing up. And she said, well, you know, what about me? Should I consider? I'm like, yeah, I want you to talk to her too, because there's some things that we could, you know, to help. So like I said, it's just kind of talking about what we see. And if the patient, you know, starts to get engaged and ask questions, you know, and we can't get scared if we don't know all the answers. Sometimes I think we're hesitant to talk about things because we don't know what the end game is going to look like. But sometimes it's just, you know, putting some things out there, let them get curious. And it's okay to say, hey, I don't know that answer, but let's find it together. I know somebody who does. Let me get you connected. So I think that's a really important point to make as we're talking about all this. How do tongue ties play a role in airway management and normal function and development? So let's start, you know, those infant stages. Like, why do tongue ties kind of set us up for long-term issues?
I love that. Okay, so that's a great question because we need to be looking at this in infancy, right? So a baby is born, need to be looking to see where their tongue is resting in their mouth, and they need to have a full evaluation of their tongue to make sure it's elevating to where it's supposed to be elevating, it's functioning properly, it's able, if it has the range of motion that it needs, because the function of the tongue is so vital, or the tongue itself is so vital in growth and development. And the way it's there's a lot about the tongue and its role in growth and development that most of us don't know about. So most people don't know that the tongue is supposed to be resting in the roof of your mouth. So the natural resting position of the tongue is the roof of the mouth. An interesting fact about the tongue. So if you think of any muscle in the body, any other muscle in the body, there is a place where it starts and there's a place where it inserts. So there's an origination of the muscle and insertion of the muscle. The tongue is the only muscle in the body that has a place where it starts. It has an origination, but it doesn't have any insertion point. So it's just this muscle out, it's just a muscle out and in our mouth. Now the theory is that the resting position or the insertion position of the tongue is the roof of the mouth. And we can see that in infants, even if they're tongue-tied, they're usually born with a high resting tongue position. Because of the tongue goes up, but then it falls down. If you close it, it goes up and then it falls down because the palate is still not, it still allows for the tongue to rest up. There are no teeth. The tongue can go up and kind of fit up there. But if there's a tight frenum, it's going to pull the tongue down. Now, with the upper jaw, so the upper jaw is made of cancellous bone, which is the same bone as our cranium. So the lower jaw is different, but everything above, so the maxilla, the sockets of the eye, the cranium, it's all cancellous bone. And the way cancellous bone grows is by pressure, mild pressure. So if you think about the head, the brain, the mushy brain from the inside, as it grows, it puts pressure on the cranium and your cranium grows the size of your brain. So you never have like a big brain, a big cranium with a little brain. So if the brain stays small, the cranium also stays small. With the upper jaw being the same bone as the cranium, the tongue resting against the roof of the mouth, and with swallowing properly, meaning we push our tongue up against the roof of the mouth in a wave-like motion. We put and we swallow between 1,800 to 2,100 times a day. We're putting pressure on the roof of the mouth, and that helps grow the upper jaw. As we grow, we grow really fast at the beginning. So the first 2 years of life, our cranium grows 50% of its full, adult size. By age 4, that's around 75%. So in the first 4 years of life, we grow a lot, and that tongue needs to be resting in those early years, needs to be resting and pushing up against the roof of the mouth to help the upper jaw grow wide and come forward. With a properly developed upper jaw should be a perfect reflection of the tongue. So with the tongue resting up, the teeth should be all around, the palate should be flat and wide. With the palate being wide and flat, and if you think about going through the roof of the mouth, you end up in the floor of the nose, in the nose, right? So the roof of the mouth is the floor of the nose. So if you think of a triangle in the middle of your face, that's the maxilla. And as the upper jaw grows, the floor of the nose also grows, which allows for more real estate to be able to breathe easier through the nose. You also get better development of the zygoma and the cheekbone. So you get better looking face with better cheekbones. We get larger sinuses that drain well. So we don't go through life with clogged sinuses and all these sinus issues. The border of the eye socket is also part of that maxillary bone. And they're currently doing research on myopia or nearsightedness and under development of the upper jaw, because if that bone part doesn't grow, then the shape of the eye is different. So there's so many things that could be affected by underdevelopment of the upper jaw. It's not just aesthetics. And obviously aesthetics is a huge part of that. We all want that wide, beautiful smile with no crowding. And if the jaw grows to its proper place, teeth come in all around the tongue, and you have this perfectly beautiful U-shaped arch. With the tongue resting up where it needs to, it also helps position the lower jaw where it needs to go. So the only communication that the upper jaw and the lower jaw have is the position of the tongue, because nowhere else is the lower jaw and upper jaw connected. The lower jaw is connected to your head and your upper jaw is in front. So they don't have a place where they're connected. They're just connected through muscle and tendons.
Yes.
The tongue resting up, the lower jaw can kind of hang off of the tongue, and the weight of the lower jaw is supported by the tongue. So the muscles of the TMJ can relax, so you don't fatigue those muscles. But also that relationship is a more normal relationship with a perfect class 1. If the tongue is resting low in the mouth, and the jaw falls back, it tends to rotate in the socket, and the upper jaw tends to fall down. So we get a longer face with a retruded lower jaw. So, I mean, this is just like a small piece of it all. There's so many ways that the tongue can impact growth and development, but this is usually the explanation I give parents, is that if we can get the tongue resting in the roof of the mouth, and we need to figure out, like, if it's not resting in the roof of the mouth, why is that? Sometimes it's tongue ties. It's estimated to be about 10%, but it's not always tongue ties. So we need to look at, tongue tie is not the only thing that could be this. There's also a lot of habit. Like you said, most patients can't breathe through the nose. If you can't breathe through your nose, you will not have a high resting tongue position, right? Your tongue has to drop down for you to be able to breathe through your nose. Yes. Because we need to breathe. that trumps everything, right? Yes. Breathing will trump everything. So if your nose is not patent and you can't breathe properly, you will have improper development.
Yes.
So,
and I'm thinking too, as you're talking about this, and you're talking about, yes, I don't think that I knew that, the whole top of the skull, maxilla, all of that is the same type of bone and grows under pressure. It leads me to think, and I'm sure this is true, that if we have a child that has an airway issue or a tongue tie issue and isn't getting that proper stimulation, tongue's not in the right position, then likely their brain will not grow as large either. Is that fair to say?
Yeah.
Well, and I'm thinking about that from the oxygen standpoint. Like if they're not breathing and getting the proper oxygen, the brain doesn't continue to grow properly. They're going to have smaller heads, smaller airways, and it's kind of a vicious cycle.
So there's definitely research showing mouth breathing and snoring being causing a reduction in IQ in children. There's definitely research showing that. So that there's definitely a connection there with breathing and IQ. Now, I don't know of the size of the brain. I don't know, seen research on that. I wouldn't be surprised if there was a connection there for sure.
Yeah, I've read the dental diet, and he talks about different sizes of the skulls now versus millennials.
Yes.
And how different, when you look at Paleolithic skulls, they were big, they were broad, there was big jaws, there was aligned teeth, they had all 32 teeth with no decay. It's pretty amazing how things have transitioned over the years.
Yes.
And another thing that I was thinking from a developmental standpoint, and I know this is probably a big conversation that you have, is obviously if our babies and our infants have tongue ties, the nursing aspect a struggle. And then getting proper nutrition if they're not able to nurse well.
Absolutely, yes. So most of the patients that I see for most of the infants I see are struggling with feeding. Their feeding struggles. Well, so most practitioners look at or recommend treating a tongue tie if a patient is not thriving, meaning that if an infant is not gaining weight. It seems like there's a lot of concentration around weight gain with infants.
Okay.
And providers, which is a super important part, obviously. But there's also so many other things that go into nursing, and like infants being happy, like I see so many infants that are gaining a lot of weight, but the mom is struggling with nipple damage and nipple pain, baby is like colicky and is just like miserable all the time. But as long as they're gaining weight, it seems like nothing else matters. And I don't think that's right.
Correct.
As we see the changes after a tongue tie release and with proper functional training of the infant, because even infants compensate, obviously. But if we can manage those compensations and have the infant using more of their natural reflexes to nurse without compensation, we see improvement in breastfeeding, but also with congestion, with sleep. There's so much more that goes into it, that I've even had a lot of patients come to me for their second or third babies, where they chose not to release their first child. They decided that they were going to wait and see because baby was gaining weight and they were doing well with the bottle or, whatever. But then later on, they were having difficulty transitioning to solid because they didn't know proper swallow. They were having issues with speech because the tongue didn't have the proper function. So this time around, they want to be more proactive because they know that there could be other things that could be impacted with a tongue tie.
Yeah.
And what I tell parents is like, I always try to treat based on current symptoms. So if you're struggling currently, I don't want to say, if you do this tongue tie release, you'll never have speech issues, or you will definitely have speech issues, because that's not true. But if an infant is not able to properly feed, or if they have an open mouth posture because they have a severe lip tie and their lip is not able to reach down, or their tongue is tied and the tongue keeps falling to the floor of the mouth, we know for a fact that there will be growth and developmental issues down the line.
Right.
So that's what we try to focus on. And again, most parents have, because I see patients sometimes 6 months post-op, infants 6 months post-op, and they are thriving. They're doing really well. And they were having like a lot of difficulty from the start. So we know it helps, but also it's a choice that a parent needs to make.
Oh, absolutely. Absolutely.
So, and we also have to, and it is surgery. So we have to like outweigh, the benefits versus the risks, and all of that, and make the best decision at the time.
Yeah.
So is not having any issues and they're having great function, they're gaining weight, but there's a tongue tie, like, do we do it? Or do we not do it?
Right.
Right.
Well, that leads me to my next question of what does that procedure actually look like? What is a tongue tie release? How do you do that?
Yeah, so there are a lot of different ways to release the tongue tie. There are two major procedures. The most commonly done procedure for tongue tie release is a frenectomy or a frenotomy, which is removing the restrictive tissue and leaving an open wound. And through wound management, meaning that the patient has to do stretches, or the parents have to do stretches on the wound site to prevent things from sticking back together. Sternotomy is the procedure of choice for infants, especially when done with the proper tool. I mean, the most important thing obviously is the skill of the provider.
Yes.
That's the tool does make a huge difference as well. We use a CO2 laser, and I can't imagine doing this without this laser because it's quick, it's efficient, it's very safe. It only cuts a few cell layers deep. And it also leaves a clean field of view for me. So like there's usually very little bleeding. So
Nice.
I can evaluate what I'm doing as I'm doing it. And then from there, we rely on the parents to do stretches to prevent things from reattaching. The other type of tongue tie release, which I use for children and adults, is called a functional frenuloplasty. And this is a method developed by Dr. Zoggy from the Breathe Institute. And it's a very thorough release of all the structures that could be affecting tongue function. The way the procedure is done, the difference is that as we go through the procedure, we're asking for different movements from the patient. So the patient's not asleep, they're functioning with their tongue. They are obviously numb, so they don't feel anything, but we are evaluating their function as we release. So we stop, we ask them to, hold their tongue to the roof of the mouth, and we see, did we get improvement? Do we get the improvements that we need? And once we get there, once we have the improvement that we need, we place stitches to close the wound site. And placing the stitches will, what we're hoping to get is primary intention healing, which is the two parts of the wound site coming together. So there's less scar tissue development, and it's been shown to have better outcomes from healing. But even with that type of treatment, even with the stitches, patient will still need to work on massaging the scar tissue, just to make sure, just like with any other surgery, just to make sure they don't build extra scar tissue in the area. So the frenuloplasty we use on children and adults as soon as they can sit for a procedure. It's about a 30-minute procedure for kids. So they need to be able to sit for that procedure,
right,
to be able to do that.
Is that also, you're still using the CO2 laser for that?
Yes, yes.
Okay.
Still using the laser, just place stitches at the end.
Got it. So obviously post-operatively, there's going to be some massage and things like that, stretching and that sort of thing. But from a recovery time standpoint, what does that look like typically? What do you recommend? Soft foods, diet, how long? What does that look like?
Yeah, so patients will be on a softer food diet for 3 to 5 days.
Okay.
The majority of my patients take pain medications the first and second day. And the first day, it's like an alternating ibuprofen, Tylenol situation. Second day is like ibuprofen. Third day, it's just if they need it. Most patients only take pain medication the first 2 days. The reason why we want softer food, obviously, the less the tongue has to work initially, the less sore it will be. So the softer diet will help with that. It will also help keep the stitches in as long as possible. The tongue moves a lot, so stitches come out if you're using it a lot. So I want the patients to kind of like rest and not do a lot of talking or sticking their tongue out or functioning with their tongue. Just want them to kind of try to rest it against the roof of the mouth and be more gentle with it. So the first week, they're just basically healing from the procedure. And then after that week, they start doing the stretches and the massaging to make sure that they're developing this long new frenum that's going to develop underneath the tongue.
Nice. So I feel like, especially for either older children or adult patients who've been functioning the same way for a long time, when you do a tongue release, obviously now there's going to be a new learning curve, right? Because we're trying to correct habits, create a proper swallow and proper positioning and breathing. So would you say most of your patients that have tongue release end up needing some myofunctional therapy as well to kind of retrain those habits?
Absolutely. It's an integral part of a functional frenuloplasty. It's all about function. Even with infants, I require therapy, meaning that I want someone to be, I do a quick assessment of their reflexes and tongue function, but if they're not functioning properly before a tongue tie release, I don't jump into a tongue tie release just because cutting tissue will not fix function. So it's all in the muscle and the muscle memory. And the reason why we do myofunctional therapy is to help to initiate the brain to send different signals to different parts of those muscles for those more proper functions. So when we do the release, there's better outcomes and we see better improvements of the symptoms we were having.
Yes.
The way I explain this to patients and the reason why we require myofunctional therapy is if you were to imagine, if you were like, I don't know, I usually use their age. If you were like 18 years old or if you were like 30 years old and all your life you had shoes with your shoelaces tied, you could still walk. You would still probably be very efficient at walking with small strides, but that's the only way you know how to walk. Now, if you were 30 years old and somebody came up to you and you said, oh my gosh, did you know your shoelaces have been tied all your life? You're like, what? No, I didn't know that. And they're like, yeah, here, let me open those shoelaces. You're not going to go to your normal walking. You're not going to take those deep, big strides. You're still going to walk the same way unless someone were to retrain you or retrain those muscles that have not been used in so long to do that function. The same thing goes with the tongue. It's a muscle. You've been compensating all your life for this restrictive tissue that you have underneath your tongue. And if you don't work on the function, if you're not changing or working on retraining that function before a release, the release itself will not fix the function.
Right.
The release itself will only give you more range of motion to be able to function better. So we do myofunctional therapy to a point where we've made a lot of improvements, but now we've kind of hit a ceiling. Like we're not improving past this point. And that's when we do the tongue tie release. So we can make a jump. We can make that improvement.
Yeah, that makes a lot of sense.
But one thing that I want to bring up here, which is a really important part of this whole treatment, we're not looking only at the tongue tie. We're not looking only at function. We also have to address the space issue. So a tongue tie could be the underlying cause of an underdeveloped upper jaw or underdeveloped mouth. But whenever the time is that we catch that tongue tie, it could have made changes to that development that may need to be addressed before you do the tongue tie release. So if you're looking at, we look at tongue tie, tongue tone and tongue space. So they're like the triplets that we look for. Because if you have, if the tongue tie has caused underdevelopment of the upper jaw, you may not have the space for the tongue to be released into. So now you have a small mouth, and when we do a release, there's nowhere for your tongue to go. So we have to kind of like work backwards.
Yeah.
You have to first develop the jaws so you have a place for the tongue to go to, then work on the function, then release the tie.
Yeah, that makes sense.
The tie, the function is there, and the space is there for the tongue to go up. If not, if you've released the tongue, if you tried your best to work on function, it is very difficult when you have a small mouth for your tongue to rest in the roof of the mouth. It's like almost impossible in some cases. If you've even done the myofunctional therapy and the tongue tie release, your tongue will still rest low because it can't fit in your upper jaw.
Right. Yeah.
So that's an important thing to also consider, is not just looking at the tongue tie. Oh, there's a tongue tie, let's do myofunctional therapy, or let's do a tongue tie release. We have to address the size issue as well. And that sometimes it's, the more complicated of all of them.
Right.
Kids, because kids are, super flexible, and you can, create all the room you want. But for adults, then depending on their level of underdevelopment, or if they had teeth removed to get a better smile, it's more difficult because now they have a very small mouth. And we have to figure out how to get this big, not the big tongue, a normal size tongue fit in small upper or small mouth.
Yeah, that makes sense. And I guess the tone part, because I hadn't ever thought about that before, but the tone part comes, I guess if you haven't been able to move it much, you've got to have low tone. So
yes.
Yeah. Huh. This is fascinating.
Yeah, it is.
You're right. This is a giant rabbit hole.
Yes.
I'd love for you to kind of tell just a few stories of patients where you've seen some really marked life change for them. Would you share just a few,
Yeah, I would love to.
Experiences?
Those are the fun ones.
Yes.
Well, with infants, obviously those changes are like, they're at the 1 week visit, right? So at the one week visit, parents come in, or the mom comes in, and they're like, I've been able to nurse so much easier. Baby's like a completely different baby. They're like calm, and they don't need to be soothed the whole time. So those stories are always like, you just feel like, okay, you just put them through this like stressful thing a week ago.
Right.
Because it is very stressful when, treating an infant. But it's very rewarding seeing them have those improvements. I've definitely had several patients refer to it for their infants as life-changing. It's been life-changing to their whole life, not just the baby's life, but just them being able to sleep, parents being able to sleep better, baby being able to sleep better, being able to feed their baby better. So that's definitely like with the infants that we see like more quick changes. With kids and adults, those usually take a little bit longer because the compensations have been there for longer. The procedure is more involved, so there's more of a recovery period. But what we see consistently is better postures, so more, less forward neck postures. We see a lot of release of neck and shoulder tension. But the most interesting ones are patients that didn't realize they had these issues. So we have like a questionnaire where they fill out like what kind of issues that they're having before a release, and then 2 weeks later we have them do it again, and we see things that they hadn't marked, like they mark improvements that they hadn't marked as issues before. And they're like, well, I never knew it was supposed to be a different way. So those are always really cool. I did have a patient that had woken up with a headache every single day in their adult life. And they were like in their late 30s. Ever since this patient was 18, they had woken up with a headache every single morning. And that stopped the night that we did the tongue tie release.
Wow.
That one was a really cool one. And he wouldn't stop talking about it. There was another patient where she was also suffering from headaches, and that was the reason why she did the release, was to help alleviate that. But she was a professional oboe player, and she taught oboe at a very reputable school, and she even recorded herself before and after. And there was a huge difference in her playing. And she's so thrilled by that, because she's a professional player. And she was like, I could never do double tongue. And I don't even know, like, I'm not even, I was like, well, that's great. So now she's like, all her students, she's like looking if one of her students is struggling getting a sound correct, she's checking their tongue ties.
That's awesome.
So, yeah, it's really interesting. Some of the changes I had a patient who felt immediately after the release, they felt like they were walking on clouds because they had so much release of their tension in their hips immediately.
Oh, wow.
We've had changes to toe position, like patients that have their toes like pointing inward. So there's just like so many different things that you would not necessarily relate to a tongue tie that we've seen changes in. And that's all because of that, the deep frontal line, which is a single piece of fascial tissue that's connected from your tongue to the tip of your toes. So you can have a lot of different things happening to the body when you do a release on the most top portion of that fascial line. So it's those are the cool stories.
Yeah. What have you seen? And this will be the last question I ask you, because I don't want to take all your time, and I know this would not be strictly just the tongue release, because this is more about creating airway, but what have you seen anecdotally for kids that typically have some ADD or ADHD kind of diagnosis? How has that changed?
Yeah, so with kids, we see a lot of grinding as well, a lot of sleep issues, breathing, and so with the tongue tie release, because that's kind of like the last thing that we do with kids. With kids, I always tend to grow and develop first. We do myofunctional therapy, so we see a lot of improvements along the way. And the tongue tie release is kind of like the last thing, the little like cherry on top. But there's definitely changes to their level of concentration during the day once they begin fully nose breathing at night. So that can be after tongue tie release. It can be after expansion, orthodontics, to be able to like have more space. And obviously parents being able to sleep through the night because their child is not climbing in their bed or waking up times a night. We've had issues with like kids that were bedwetting into, their later, like 5, 6, 7, 8-year-olds that are still bedwetting every night that were able to stop. But all of those are a combination therapy, addressing all the different aspects of it. But I've had a couple of cases where we saw huge changes in their body posture. We had a couple of kids that had slanted necks, or I had, and I get those from PTs with babies that had torticollis as an infant, and they still like they worked with therapists and they did all the things and things are corrected, but they still have a change or a slant in their spine, and those get corrected after tongue tie release, and those are really cool to see.
Yeah, I bet. Wow, what a cool way to really impact people's lives. You know, we have such privilege in dentistry to
So true.
change lives. And it's, you know, I think that gets lost on us sometimes. We kind of forget that. So I am super grateful for this conversation. For those of our listeners that are hearing this and thinking, gosh, I kind of want to know more, I want to learn more about this. You know, I want to see the bigger picture here. Where do you recommend they turn for more education and training?
So my highest recommendation would be the Breathe Institute, the Dr. Sarusagi and the Breathe Institute. They have a lot of different courses geared towards hygienists and dentists as well. But they are at the forefront of research when it comes to tongue ties and airway as a whole. Dr. Zagi has a 5-day course that he covers all things airway, and it's a very in-depth, deep dive into airway. But they also have like other like small courses. I think that would be a really great place to start.
Okay.
And have like the most recent information when it comes to the research of it all.
Awesome. Well, I want to thank you for your time and your expertise. This has been really engaging and exciting, and hopefully, you know, our listeners are kind of hearing something maybe new and different, you know, new ways to look at and help our patients. So I want to thank you for sharing all of that with us tonight or today. And, you know, is there any last words you want to leave us with?
No, I just wanted to say that it's been a pleasure. Thank you for having me. I enjoyed the conversation. Obviously, these always like go long because I know
You're good. You're good.
So passionate about it. But yeah, so I really appreciate it, and I've really enjoyed the conversation. Thank you.
Yeah, absolutely. And to all of you listeners, if you feel like you have some questions that you need answered, or you need more info, I always say come find us on our Mighty Network. It's a free app you download on your phone, search Bulletproof Hygiene, and come join the community. I know there's several of you out there that know this stuff really well. Chime in and help those of us who are still learning out. That is what community is all about. Everybody have a great week, and we will see you next time. Bye-bye, everybody.
Bye.